Okay, we can go ahead.
Hello, everyone. So this is Team One, and here we have me, Abdikhani, and then also Sabrina, and then Yasir. And then we chose to research about healthcare and the issue and healthcare issues in the United States. Just some introductions. So healthcare in the United States faces significant challenges, including high costs, access disparities, and varying quality of care. Our research aims to understand these issues and explore solutions to improve healthcare outcomes for all Americans. So just some statistics. The US spends more on healthcare per capita than any other country. And then the impact it has on individuals. These high costs can lead to financial strain and even bankruptcy for some families. Just some comparisons to other countries. U.S. healthcare costs are significantly higher compared to other developed nations. And then moving on to disparities in healthcare access. So geographic disparities, rural areas often have fewer healthcare providers and facilities, and then also economic disparities. Low-income individuals may struggle to afford care. And then we also have racial and ethnic disparities. So minority groups often face barriers to accessing quality healthcare. And now move on to Yasser.
Hello, everyone. Yasir here. So, there is definitely variability in quality of care, just like Abdikani talked about. It really depends where you live and for the care that you'll get. Especially if you live in like a rural area, you might not have the same health outcome as someone who lives in a city, or often like from state to state or within the same state, different cities, and so on. Um, Between providers also and regions, just like I said. And then there's impacts on health outcomes, which lead to different health outcomes across the population. So that can affect everyone separately as well. And then there's factors such as education, resources, and healthcare policies, which all do play along. They play a role for the health outcome. And for this research, I did have the chance to interview MK, who is my roommate. He has chose his initials to be referred to as MK. That's his initials, first and last name. He has lived in Saudi Arabia. He firsthand has a lot of experience when it comes to that. He was a perfect example because, like I said, he lived outside the country, especially a country like Saudi Arabia, which has a way different approach to healthcare, unlike the U.S. So Saudi Arabia, it has a predominantly government-funded system providing absolutely free healthcare to all its citizens. You don't have to pay a deductible. You don't have to pay anything. So when I talked with MK, he was really passionate about that, and he wished to have had that in the U.S. Ever since he immigrated here, he never understood why it's so expensive here. Uh, he once told me an ambulance ride would cost nothing there, and then over here is like 10, even if the hospital is like 10 minutes away, it would cost that much just to run an ambulance for like a mile. Um, yeah, goodness, that's quite a bit. And then with the comparison to the U.S., there's a big different, the benefits, the limitation of Saudi healthcare model compared to the U.S. And then for the key takeaways, I will definitely leave that for later. But what I want to talk about is looking it up, my notes. So there's definitely a cost efficiency, unlike the US where healthcare costs can be a significant burden, especially if you don't have coverage. Uh, Saudi Arabia is government funded, provides financial relief to everybody. So it's not like, it's not going to leave you with like a burden, especially if you have to take a loan out or um, if you have like a lot of debt because of healthcare, it should be, one of the basic needs, of someone. Um, there is definitely also in the US, there's like a big difference to like status. So like someone who's rich would get like way better quality healthcare than someone who doesn't have much money or like the average working person. Over there, it's not like that. He said the universal coverage model helps ensure healthcare services are accessible to all, regardless of socioeconomic status. Um, they have like a monarchy over there. They have a king, so the king would get the same healthcare and the same treatment as the average person. They don't have like a really big difference. It's depending on your status, which was really very much interesting. Um, so yeah, MK had a really good time when he lived there, and he never had to worry about ever paying a deductible, any money out of pocket for that for healthcare, and he really enjoyed his time there, and ever since he immigrated here, he really had to be careful. He said he lived in Massachusetts, and he currently lives here in Wisconsin. Even state to state, he told me like it's different. And Massachusetts, it reminds him more of Saudi Arabia's model, where it's not like it's not fully you know government or state funded, but it comes like close to that, where he didn't have to pay a lot of money like he does in Wisconsin. Unfortunately, in Wisconsin, yeah, well, it's not a great place when it comes to that. But he's getting along pretty okay. Um, so moving on, Abdikan is going to be talking about some of the solutions we can that can help bridge that
Yeah,
gap.
yeah. Just to add on one thing on that, and then just learning about how other nations' healthcare systems works compared to how ours in the United States works was very eye-opening. Learning, and I always just imagined how it would be for us if we lived in that kind of system and not having to worry about, especially growing up in not a very wealthy family, just not worrying about having to pay for healthcare. That was a very eye-opening thing to learn about. And then just moving on to solutions. So our solution, it will be to create a national healthcare system. So the government will provide healthcare to everyone, like how Medicare currently works for senior citizens. This system would cover all medical needs, so such as like doctor visits, hospital stays, medication costs, dental care, and then mental health services at no cost to anyone. How we'll be able to fund this system will be through taxes. So to pay for this system, taxes will be collected from individuals and businesses. Mostly is going to be through wealthy people, and big companies would have to pay more in taxes. And then also savings from simplified billings. So by removing private insurance companies, we would save money on administrative costs, which could help fund the system. Then how we'll be able to control the costs? We do have to negotiate and medical prices. So the government would negotiate prices with pharmaceutical companies to lower the prices for medication. Also, budget. We have to budget limits for hospitals. So hospitals and healthcare providers would have to set budgets to keep costs under control. And then also focusing on prevention. So emphasizing preventative care like regular checkups and vaccinations can help reduce long-term healthcare costs by keeping people healthier. And then also improving access and quality. How we'll be able to do that will be we do need more healthcare workers. So training and more doctors, nurses, and other healthcare workers to ensure everyone can get the care they need. So just investing more into even med schools and then med students. Also, we do need better technology and facilities. So investing in healthcare technology and then building more clinics in hospitals, especially in areas that need it the most. Then we also need public health programs. So promoting health lifestyles and addressing issues like poverty and poor housings that can affect health. And then transitioning to this new system, we'll do a gradual rollout. So we have to implement the system gradually so everyone can adjust and the transition will be smooth. Also, we do need public information. So informing people how the system will work and what they will need to expect from it. Also, we do need the support for affected workers. So providing help and training for workers in private insurance industries who may lose their jobs due to this change. And then just moving on uh, to the benefits and challenges of this system. So the benefits is we will have equal access. So everyone would have access to healthcare they need regardless of their income and job status. Also, and the cost savings will be another benefits. So this system would say could save money by reducing administrative costs and focusing on preventative care. And then some challenges, but for the system, it will be that the change would require political support and cooperations, which is very hard to get, as well as adjustment from those used in the current system. So this solution would aim to make healthcare accessible and affordable for everyone in the United States, making sure that no one has to worry about paying for medical care. And then moving on to Yasser.
Okay. So the big lesson for the United States is, of course, we do have like way more people than you know than Saudi Arabia, for example. And we don't have the same situation as them, where they rely on mostly like their oil exports and oil industry to fund the healthcare and all their other projects. But we can really take away and look at how the Saudi model, which is a government funding and universal access, could be adapted to improve the U.S. healthcare system. We can take away those valuable insights and compare, see what we can do in terms of population wise, well, how we can use it, and how we can use it. The conclusion, this is a journey definitely that will take time, and it will take collective effort, and everybody has to work together to reach such a goal, such a big goal, I should say. Um, by learning from global examples such as Saudi Arabia. It's not just Saudi Arabia. A lot of like more developed nations, such as in Europe, European nations, the likes of Netherlands, Germany, Italy, Sweden. All of them have, and even the UK. I think almost all of Europe has, government funded, free for all basically healthcare systems. We can take a look at all of them, compare and see what we can take away from them and implement here in the United States. So all of us can work towards a healthier future for all of us. And thanks for your time. This concludes our presentation.